Hi, my name is Joseph from Mental Health Europe, and today we're going to be discussing stigma and discrimination, what these are, how they relate to mental health, and what you can do about them. Stigma refers to the negative attitudes, stereotypes, and misconceptions that we may hold towards a certain group or individuals as a result of certain characteristics we perceive, including how we see those with lived experience of mental health issues. Discrimination, on the other hand, refers to the unfair treatment or exclusion of a person because of the aforementioned characteristics, including a person's mental health. Stigma can cause great shame for people and discourage them from speaking out about their problems or from seeking help. Discrimination directly impacts people, barring them from the necessary help or the ability to live a normal life. Both are extremely detrimental to a person's well-being and ultimately to all of society. Stigma and discrimination can show up in different ways in our personal lives, amongst friends, families, and colleagues. There are two types of stigma that can come into play when looking at these interpersonal dynamics: social and self-stigma. The first, social stigma, is how negative perceptions of mental health can impact your friendships, family life, and workplace or school interactions. Examples of these might include friends distancing themselves, families being dismissive of mental health struggles, or workplace and school gossip. The second is self-stigma, where internalized negative beliefs about mental health can impact your self-esteem and your willingness to seek help or recovery. This might include believing that your mental health makes you less than others and that you are deserving of the suffering you are experiencing. All stigma is heavily driven by the words we use, as these shape our understanding of the things we discuss. When it comes to mental health, much of the language we commonly use leads to further stigmatization. To help people better understand and reflect on the language they use, Mental Health Europe has created a glossary of words and terms that can be more or less stigmatizing. You can find this glossary on our website. Let us know in the comments below if you'd like to see a video covering the contents of the glossary. Stigma and discrimination can also occur at a structural level. This can mean various things, but usually includes an institution treating you differently as a result of your mental health. We'll provide a few examples of the kinds of institutions that might discriminate and how they might do this, but this should by no means be seen as a comprehensive list. Firstly, healthcare systems may provide unequal treatment, dismiss symptoms of other illnesses, or create undue barriers to accessing mental health care. Secondly, workplaces might refuse to hire you as a result of mental health issues, wrongfully terminate your employment, or refuse to provide reasonable accommodations. Next, your place of education, be it school or university, might not support you during tough times, or may not provide appropriate levels of mental health education or a culture of inclusion where all can thrive. Lastly, the legal system may discriminate against you, either by passing laws that unfairly impact you or by passing unfair legal judgments as a result of your mental health issue. So what can you do to protect yourself and your loved ones against stigma and discrimination? To begin with, it's important to note that most cases of discrimination are outright illegal. As such, you have certain legal protections against these. There are a few legal texts and precedents that form the basis for these protections and rights. In Europe, there are multiple specific legal mechanisms that provide these rights. The United Nations Convention on the Rights of Persons with Disabilities prohibits discrimination on the basis of disabilities, including psychosocial disabilities. The UNCRPD also provides that reasonable accommodations must be provided to persons with disabilities. Reasonable accommodations are changes that an organization must provide to people with disabilities that allow them equal access to such things as work, studies, and healthcare. The European Charter of Fundamental Rights specifically prohibits discrimination on the basis of many aspects, including disability. The European Pillar of Social Rights calls for the inclusion of people with disabilities in many aspects of life, including education, training, access to healthcare, and employment. These rights should provide you with a basis upon which you can request certain reasonable accommodations from institutions such as your school or work. Also a means by which you can call upon legal mechanisms to protect yourself should you become the victim of discrimination. Should you or someone you know fall victim to discrimination as a result of mental health problems or other factors, there is support available to you. You might be interested in one of the many mental health advocacy groups that exist in your country. Check out our website for a full list. You might reach out to organisations providing legal aid, such as a national ombudsman, a workplace HR, if such a service exists and you consider it a safe space. Or you might be interested to know that there are often community support systems that cater to your specific situation. Now that we've covered what stigma and discrimination are, and what you can do about them if it happens to you personally or to someone you know, we need to acknowledge that these problems are ones that need to be addressed at a societal level. There are 3 ways we can implement change on a larger scale. Firstly, we can challenge the stereotypes we see presented in our everyday life, as well as in places like entertainment media, like TV shows and movies, the news cycle, and national discussions. Next, and possibly most importantly, we need to see real policy changes. This might include better funding for mental health support, legal reforms that take into account avoiding discrimination against people with mental health problems, and workplace and schools developing well-being policies. You can hold politicians accountable for this. Finally, we should encourage individuals to support friends, families, and co-workers who might be facing mental health problems, creating understanding, safe places to discuss, and helping them take action to protect their rights. In the end, it's important to keep in mind how stigma can impact us all and how our misconceptions and language can feed into stigmatizing narratives. It's also very important to remember that discrimination on the basis of mental health is illegal and should be reported to the relevant persons or organizations. If you or someone you know have been impacted by the topics of this video, you can find a list of organizations in your country on our website. Thank you for watching. Be sure to follow for more videos on mental health, and why not leave us a comment letting us know what topics you'd like to see us discuss in another video or short.